everyone, how are you? I hope you are in good condition during pandemic and this pandemic will gonna be over. Well, I will introduce myself. My name is Putri Mayalisa Hana, and now I'm in the 4th semester of Nutrition Department, Health Polytechnic Ministry of Polkesmar. And in this video, I will talk about pros and cons of ketogenic diet. And before we start, I will show you a prevalence of overweight and obesity in Indonesia. As you can see, every 5 years, a value has increased. Because of that, many people think that they have to change their body shape by going on a diet, and a lot of people is misinterpret about a definition of the diet, and they think that diet is not eat or just a little bit eating or only aiming to being thin, and I think this is the wrong definition of a diet, and I will show you a right definition about the diet. Diet in the Supplementary Nutrition for Family Health Dictionary 2009 issued by the Indonesian Nutritionist Association in Indonesia, or we call Persagi, diet has the meaning regulating the pattern and consumption of food and drink that are prohibited, limited in quantity, modified, or obtained in a certain amount to achieve goals, such as disease therapy, health, or lose weight. And there are so many types of diet. Popular diet in Indonesia is like low carbohydrate diet, low fat diet, OCD diet, and ketogenic diet. And I like to talk about ketogenic diet. So this is the part of my presentation. There are helpful 4 parts of presentation, and the first one is definition of ketogenic diet, and the second is the function of ketogenic diet, and the third is the effect of the impact of ketogenic diet, and the last is the opinion of ketogenic diet. And the last is the opinion of the expert. And the first one, I'm going to talk about of the definition of ketogenic diet. The ketogenic diet is a diet that uses a lot of fat or increases the consumption of fat as an energy source and reduces the consumption of carbohydrate and protein when the body does not get enough glucose from carbohydrate. And normally, body takes the energy from the carbohydrate, but in this case or in this diet, the consumption of the carbohydrate is limited, so the body is take energy from the fat. So this is the distribution. Fat around 55% to 60%, and protein is 30% to 35%, and carbohydrate is 5% to 10%. And even so, the consumption of fat should not to be careless, and the recommended of sources fat is unsaturated fat like olive oil, avocado, fish oil, or vegetable oil. And the next part is the function of ketogenic diet. And before we talking about that, and do you know, since 1920, the ketogenic diet has been recognized as an effective therapy for severe epilepsy in children. And along with increasing time and technological development, the diet can be the program for weight loss for normal people. And there's the function of the ketogenic diet, and of course the main goal is losing weight quickly, and the second one is the reducing seizures in people with epilepsy, and the third is reducing the risk of type 2 diabetes. Why? Because as we know that ketogenic diet is limited to consumption of carbohydrate, which is carbohydrate are the one of glucose producers for our body. consumption of ketogenic diet is reducing cardiovascular risk by reducing LDL value. And as we know that a ketogenic diet is more consumption of unsaturated fat, that unsaturated fat can increasing your HDL value and reducing your LDL value. And the next part we talk about the impact or the effect of ketogenic diet. The first one is ketoflu. Have you heard about ketoflu? Ketoflu is symptom of ketosis, and ketosis is caused by ketogenic diet. And the symptom of ketoflu is headache or dizziness or irritability and etc. And the more impact is dehydration, mineral and food disturbance, hormonal change, metabolic disorders, emotional emotional disturbances. So the titers is recommended to drink a lot and increases the consumption of salt and take a lot of supplement and more vegetable to decrease of this for the effect of ketogenic diet. And the last part is the expert opinion. For agree or pros are there has been anecdotal evidence of people losing weight on the ketogenic diet, says Melinda Ehring, MD, Director of Northwest Medicine Author Center for Integrative Medicine. And Dr. Melinda says that people also report feeling less hungry than other people types of restricted diet. And the disagree opinion is the ketogenic diet can be effective for weight loss when used in a short time period, followed by the adoption of healthy eating habits, say cardiologist Kamesmari Makanti, MD, Northwestern Medicine Cardiovascular Institute. And Dr. Maganti says that unfortunately it lends itself to yo-yo dieting, which increases mortality. And more opinion is, in the practice, many people eat high amount of saturated fats, which could increase cardiovascular disease risks, say Dr. Maganti. We see an increase in lipids or fats in the blood of patients on the keto diet within 6 to 8 weeks. So this is the conclusion of the presentation, and the concept of the ketogenic diet is to replace energy from the carbohydrate convert to fat. And this ketogenic diet has the effect on the impact and the benefits that causes several opinions from the different experts. And based on my journal, literature that I read, and my knowledge, this diet is okay to do. However, it requires special assistance by expert, not recommended for a long period. And even so, surely every diet has a different impact, so we must be careful and study more deeply to choose the diet. And this is the last of my presentation. If you have a question, please ask in the comment section below, and I like to answer it. And I hope you are enjoying on my presentation, and thank you for watching, and sorry for my mistake during presentation, and see you next time. Stay healthy and bye. Wassalamualaikum warahmatullahi wabarakatuh.